I think about 200,000 people died because of this storm.
Well, Aloha Medical Mission treats indigent patients all over Asia, and we also like to respond to emergencies.
And this is Mrs. Dayon, and she's a 65-year-old grandmother, and she's seen today complaining of dizziness and weakness and insomnia for the past 2 months, ever since the cyclone. And she lost her 5 grandchildren, her 5 grandsons, and their mother. They were traveling by boat the night that the cyclone hit.
This storm is very unusual. We first hit Laboda. Laboda was like Bogale, half sea and half land. But the storm didn't came through into the Bogale. Instead, it destroyed the Bogale. The storm get much stronger after hitting the Laboda. It gets stronger, and then it moved a little bit down to the what you call south again, where the Bogale is. Then from Bogale, it hit again because the storm became very strong again and hit Bogale. So it's not 2 times, it's only a time. Hit one place one time and then move to another place and hit again. Then it enters to the land.
We're here in Aya Island village on the south coast of Burma. It's taken us 2 days to get here by bus and boat. This is where Cyclone Nargis first hit landfall on the 4th of May 2008, about 2 months ago. One of the first things to fall was this famous landmark pagoda, and as the cyclone moved in, numerous coconut trees and houses were blown over. You can see many people died. This is a populous region before. A lot of these kids are orphaned now. A lot of families lost children. A lot of women and children died because they couldn't swim. So Aloha Medical Mission is here treating patients, dispensing medication, giving some comfort, and just showing people that we care. The world has been watching this disaster since its inception, but nobody's been able to actually get in here. We're the first foreign medical people that these people have ever seen, and the first foreign medical people in this region after the cyclone.
I joined the Aloha about 15 years ago and have been taking about 4 missions a year ever since. Soon after the cyclone hit Burma, I applied to send our team here, but permission was denied, as was many other international groups. But I was able to contact this Seadal, and he worked to get us visas and permission to work in this area.
According to the Buddhist standpoint, suffering. What is a suffering? Disease, decay, death, separation from beloved one, separation, association with hatred person. These are suffering is okay, but upper level suffering.
The acute injuries have already been taken care of, but we'll be seeing things like abscesses and infected wounds. Well, we hope to see and treat as many patients as possible and be able to do some training to the local staff.
During the Nargis, during the cyclone period, okay, and she came here, they stitch it, and she doesn't take the time antibiotic, and she doesn't take regularly. Amputation, you have to take it off. Oh.
A little 4-month-old girl who mom says has been having fever and coughing and wheezing since she was born, but she has been breastfeeding well, and if you look at her, she's very healthy. So we're going to just examine her right now to see, and then what we can do too is we'll check her temperature under her arm.
So she has a tooth infection, and we'll treat that with antibiotics. Okay. We're also going to give her vitamins to make her stronger. And let me listen to her breathing, okay? With the storm, did she have any family members who were killed?
Her mother and her mother and home.
Her mother's home?
Live in her home.
Oh.
Yes.
I'm very sorry.
Amada Rahida Hondu Arakandu Vidipano Adana Salogana Udi Bawadu Nabana Adana Misa Logis
So I'm seeing this 2.5-year-old baby boy who's with his mother, and he comes in. He's had diarrhea, gastroenteritis for 2 months now that started immediately after the storm. And I just am interviewing the mother, and as it turns out, we were just walking on the beach today during our break from the clinic, and it turns out that they lived on the very front row of homes on the beach, and that when the storm made landfall at 5 p.m. that day, after which their home was blown over within probably an hour or two, at about 8 p.m. of the storm, they fled from the beach to this clinic, where they stayed for 2 days. Interestingly, the storm surge actually came up into this area in the clinic that they're sitting in. She had actually stacked benches up in this clinic, and she was holding her son in her arms, holding both her and her son above water in the clinic that we're sitting in right now, which is pretty eerie and pretty amazing.
So this patient was about to leave, and the baby had a seizure due to fever because it's got an infection. So it stopped breathing, which you do sometimes, you get epic. So we had to instruct the mom how to use the ibuprofen and make sure the baby had a good airway and could breathe until it finished seizing. So we gave some ibuprofen, and he's going to have antibiotics, and now the baby should be better. So we did a lot of teaching on how to give fluids when babies are very hot. They become dehydrated.
For the time being, we have to give some multivitamins, and after that we have to arrange to refer to the cardiac surgeon whether she may need the cardiac operation or not.
We did an unusual case last year in Sagai, which was a bowel resection for a colon cancer at nighttime without electricity, so no OR lights, but with an enthusiastic team. We had plenty flashlights and everybody's good heart and effort. The elderly man made it through surgery. He required a ventilator overnight, and local nurses took turns providing ambu bag ventilation, and he survived the night and the next 4 days and was alive when we left. And looked pretty good, so at least he was given a chance. So that was an example of a life-saving procedure, but most procedures, almost all procedures we do, are improving quality of life.
What I'm doing now is present Dr. A here, the island doctor, with the diagnostic set, otoscope set, so he can continue to care for his patient when the Aloha Medical Mission leave to go back to the United States. Dr. A is responsible for the whole island. How many population do you have, doctor, that you're responsible for?
Altogether 16,000.
For 16,000, he's the only doctor responsible for their care, and he does not have a diagnostic set. But on behalf of Aloha Medical Mission, it's my pleasure to present Dr. A with the diagnostic set, which has been mine for a little while, for a few days. So I'm pleasure to give it to you, doctor.
Yes,
thank you. Continue the good work of the patient. Yes. All right, thank you.
I think this coming to places like this should be part of every doctor's career.
Adana